Hello, everyone. Thank you for joining us at this 11th session of ISSUP Nigeria chapter bi-monthly webinar, tagged ISSUP Nigeria Knowledge Update Series. First, let me sincerely apologize for coming or for starting a little bit late. This is because of some technical issues. And as it is in different parts of Nigeria at the moment, it is raining, and that is also affecting our internet connectivity and so on. So please bear with us, and thank you for your patience. So this, of course, is the second webinar for this year, and it is coming just a month before the ISSUP conference in Abu Dhabi. So for those who will be able to make it to Abu Dhabi, especially colleagues joining us from different parts of the world, it will be a very good opportunity to meet one-on-one at the conference. So I look forward to seeing as many as possible. So today we shall be looking at a very important topic, which is harm reduction, concepts and applications in Nigeria. So you will agree with me that the harm reduction is a very important topic, and I also want to believe that there will be a lot of questions in the course of this webinar. Please feel free to use the chat box to send your questions and share your thoughts during the presentation. And we want to benefit from your wealth of knowledge and expertise as well. So to moderate this session with me today is Ejike Bishop Oguje. Bishop is a member of the editorial team of ISSUP Nigeria chapter. And we are also hoping that Dr. Bao James will be able to join us in the course of the webinar. So before we commence, let me quickly introduce the speaker for today. And the speaker is Dr. Ukachi Madukwe. And Dr. Madukwe holds a PhD in guidance psychology from Imo State University. She presently lectures at the University of at the Imo State University in the Department of Psychology, Faculty of Social Sciences, Owerri. Dr. Madukwe is a member of the Nigerian Psychological Association, the current and pioneer chairman of the Association of Counselling Psychologists in Nigeria, and the pioneer counseling psychologist at the Imo State University Psychological Services Center. She is a consultant counselor and offers counseling services in the areas of mental health, family, marriage, addiction, career, youth, and relationship. She is a professional drug demand reduction member of ISSUP and the state coordinator of ISSUP Imo State Branch of the Nigerian chapter. Her research work is centered on harm reduction, motivational interviewing, drug use prevention, treatment, and rehabilitation. So colleagues and participants, please join me as I invite Dr. Madukwe to take it up from here. Doctor, over to you. Dr. Madukwe, over to you, please. Dr. Madukwe, can you hear me?
And
Dr. Madukwe, over to you, if you can hear me. Dr. Madukwe, can you hear me? Hello, doctor.
Okay, I want to welcome the attendees and also apologize for these tech issues with network. Today, I welcome you to Nigeria ISSUP. Hello, sir, I can hear you. Can you hear me? Can I go ahead?
Please go on.
Yes, we can hear you.
I don't know if I should go ahead or not. Okay. Let me welcome once again the attendees to the event. And I apologize for the technical issues we are having. To continue with the program, I would like to remind us of the learning outcomes as we plan them and advertise them earlier. One, we hope that by the end of this presentation, attendees will be able to learn about harm reduction and how we can use it as or incorporate it into drug demand reduction. We want to also believe that attendees will be able to learn the different harm reduction strategies and their applications. Some of these harm reduction practices that are already in Nigeria will also be highlighted, and then we look at going into this. We have taken a lot of time. Ab initio, I had wants to take a few seconds to answer this question. What do we do if an individual who uses substance does not wish to stop? What do we do then? But then you can send in your answer as a chat. We'll look at it later on. As a background to this discussion, it is important for us to look at the prevalence rate of substance use in Nigeria as against what we have at the global level. The current UNODC World Drug Report provides that across Africa, as at 2028, drug projected that by would rise, prevalence level in Africa would rise by 40%, meaning that at that point, Africa would have exceeded both Asia and North America in the issues that has to do with drug use. On the slide we have now, we are looking at locally what we have, the prevalence rate in Nigeria as a nation, as well as the prevalence rate in the different states in Nigeria. You look at the drugs entirely and then particular drugs. In this particular slide, I'm interested in the most used substances in Nigeria. We have alcohol, tobacco, and cannabis. Based on the last UNODC National Drug Survey in Nigeria, we have it that prevalence of tobacco use in Nigeria is about 15%. That of cannabis is 10.8%. For alcohol, we have 20% for males and 13% for females. When we compare this to the prevalence rates for pharmaceutical opioids, which stands at 4.7% for according to the same report, we see that the prevalence rate of these first three substances is really high compared to pharmaceutical opioids. Nevertheless, we know that the pharmaceutical opioids are a big challenge they are considered to be more harmful than cannabis, so to say. And as such, in most cases, they are projected by nations and by substance challenges. Now, when we talk about these issues around prevalence, the same UNODC 2018 survey provided that 1 in every 5 drug users in Nigeria is dependent. 1 in every 3 cannabis users in Nigeria is dependent. And 1 in every 5 opioid users in Nigeria is dependent. Being dependent means that the individual has lost control of when or how to use. This individual can no longer function without using these substances. This individual might be suffering from one harm or the other. This individual needs help to even function properly again in the society. So when we say that someone is dependent on drug use, this individual have moved away from the realm of some level of normal functioning. And is within the problems or within the challenges of harmful. When we have taken a look at those problems, we realize, consider the harm reduction as a major approach to drug demand reduction in Nigeria. What does harm reduction stand for? Many a times people misunderstand harm reduction to mean encouraging substance use, but this is not the situation. Harm reduction does not encourage substance use. Instead, helping users who are not yet ready to stop using, getting users who need to quit, but they don't have access to maybe treatment, access to some level of support that will enable them to quit. The harm reduction looks at helping those individuals who, because need solution is there to give the opportunity is used harmfully. You have to bring that person to a safer level of use than to allow that person to die. So harm reduction
Hello, Anne. Hello, Anne, are you still there? Hello, Anne, can you hear me? Participants, apology once again for the network issue we are experiencing. Please bear with us as I encourage each and everyone, especially those who have questions or things that they possibly need clarifications, to use the chat box at this point, and we can also at least use that as part of a discussion, while we wait for Anne to at least be able to at least connect properly. Thank you for your understanding. Participants, once again, apology, and will join us in a few minutes from now. Please feel free to send questions, even if the questions are not related to what she has said so far, but questions relating to harm reduction, we can use that as interaction to more or less educate ourselves on the way forward and possibly learn from one another. Thank you for your patience.
Hi, Anne. I hope that you can hear me. I have opened your PowerPoint presentation from my side, which we hope will help the connection challenges. So if you are able to unmute your microphone, you can direct me when to move forward with your slides, and hopefully this should help.
Thank you, Olivia. We'll sort that one out now.
Anne, are you able to hear us?
Sorry, Olivia, Anne is not able to hear us at the moment.
Okay. Thanks.
Yes, Dr. Richard, we are still on. We sincerely apologize for the network issues that we are experiencing. We are still on. Thank you. Thank you, participants. There's a question here. I'm not sure. Okay, I'm not sure whether it is from Salisu or so. The question is, how do we help someone who is not willing to quit? How will harm reduction help someone who is not willing to quit? At this moment, let me hold brief for the speaker. I will also say that it is not just a one size fits all. It depends on the different substances. And on the substance that the person is using, that will determine the type of harm reduction approach that may be used. For instance, if you talk of the opioids and the opioids, alcohol, and even tobacco, there are medication-assisted treatments for persons to support such person, and it also depends on individual assessment or the assessment of the individual to determine or to decide what type of harm reduction approach or strategy that may be adopted. So I want to believe the speaker will also talk about it. So generally, we believe in individual approach to intervention, depending on the substance that the person is using and other considerations, including recovery capital to decide. You know, of course, working with the client or the patient to more or less agree on what is most appropriate. And just like the speaker said before, the network issue, harm reduction is not to promote drug use, but instead to keep those who are using drugs and are finding it difficult to stop alive before eventually they get to the stage of abstinence. If actually abstinence is the overall goal, because not everyone can attain or stop using drugs for a number of reasons. So for such people, we need to keep them alive, you know, while their drug use is not causing so much harm to them. So in other words, whatever one can do to reduce the harm, you know, to individual who is using a drug, you know, we go a long way. And at times, it also depends on how we define treatment success. In some cases, we define success in treatment for persons with substance use disorders as when the person eventually stops using drugs. That is not only the criteria for which treatment in success should be considered. Of course, a reduction in quantity and a reduction in harm associated to drug use to the individual is all part of treatment sources. I think Anne is back now. I don't know whether I answered the question to your satisfaction. If it is not too clear or you need further clarification, please feel free to use the chat box. As we welcome Anne to take it off from here, and Olivia, please still be on standby to at least help go through the slides. Thank you. Anne, can you hear me now?
Yes, I can. Thank you so much.
Okay, good. You are welcome.
May I go ahead?
Please go ahead.
Thank you. So we are at the rationale behind the harm reduction. Okay. And we are looking at the fact that harm reduction is all about the can you hear me?
Yes, I can hear you, except that we are not seeing the screen. Olivia, please, are you there to help share the screen?
Yes, absolutely. If
help share our slides.
Yeah,
okay,
I can.
Thank you, Olivia.
That's no problem.
Okay.
Olivia, I can't see the screen too. Should I go ahead? I can go ahead.
We can see your presentation now. So if you put your PowerPoint in slideshow mode, that should work well. Great, thank you.
Okay. Very sorry to all involved, our dear audience. Moving ahead from here, the harm reduction rationale, the reason behind the harm reduction is that we're looking at the possibility of helping individuals who are high-risk substance users and problematic users, helping them to be able to live out their life without being further endangered by the level of substance they are involved, level of substance use they are involved in. So when we talk about the harm reduction rationale, we are trying to look at how possible it is to keep those who use substances safe as well as healthy, even when they continue to use, even when they have not gotten to the point of abstinence. Harm reduction is a different approach from prohibition. Even though both of them have similar goals, but they use different approaches. While harm reduction is using a public health approach, the prohibition approach is that of law enforcement and punishment. Also, when we look at harm reduction, we are considering the consumers, people who use drugs, while prohibition looks at dealers, and in some cases, for some nations, they also consider punish those who use drugs. Harm reduction is a lot cheaper. Funding harm reduction is a lot cheaper than funding prohibition. Prohibition uses law enforcement agents to try to stop or mitigate against drug trafficking, production, distribution, and the likes of it, while harm reduction is targeting individuals who are using these substances, seeing them as people who are actually suffering from some level of disease. So they see substance use as someone being actually sick, because like I was saying earlier, when somebody is dependent, that person is no longer in charge, that person is no longer in control, that person is no longer able to say no to substance use. So while both prohibition and harm reduction have similar goals, which is reducing substance reducing demand, reducing supply of these psychoactive substances, they use different approaches. And we think the harm reduction, when it comes to consumers, is very productive and efficient and effective, because It helps with saving life. It helps with reducing the burden of disease. It helps with reducing premature deaths. So when individuals who are interested in harm reduction, when we can get the drug users to begin to consider harm reduction, it simply means that they would reduce also the quantity of substances they are using. And this has a ripple effect on both demand reduction as well as supply reduction. Application. We have different substances, as I highlighted earlier. In this area, I had tried my best to put this application as per particular substances. Drugs and injection drug use harm reduction heading is looking at both cannabis, pharmaceutical opioids, and every other in people with injection drug use, injectable drugs. They are all in that class, and these are various areas where harm reduction strategies have been or can be applied in this case. Under alcohol harm reduction, which is not so popular, alcohol and tobacco are not so popular, especially for us here in Nigeria. We have areas we can apply harm reduction like alcohol poisoning, accidents, injuries, mental illness, drug use, automobile accidents, which is a big issue in Nigeria. We have recurrent issues of automobile accidents in Nigeria, as well as violence, whether it's domestic, intimate partner violence, other social group violence. These things are common, very common in Nigeria. We have suicide. We have then the issue of disability due to substance use, due to alcohol use, is also a major problem. When we look at tobacco harm reduction, each of these challenges as listed here are all areas we could apply the various harm reduction strategies. Now, harm reduction can also be applied at the healthcare centers, our community healthcare centers, at the primary healthcare level. This we have not been able to achieve yet in Nigeria. We have not started using, even though the National Drug Control Master Plan, the 2021-2025 report that just came out, is pointing towards that too. It has seen the need to bring substance use treatment to the primary care level, and that is something that we should be happy about. That is for those of us who are substance use professionals. We have public health approach. We can also, with harm reduction, take a public health approach. We could also look at harm reduction policies, developing policies that can help us apply harm reduction strategies, because we can't really do most of this if we don't have legal backing. Now, the NDCMP that I mentioned earlier, the document that we have now, actually provides, this is where we are in Nigeria now when it comes to harm reduction. It actually provides these services, this package for application of harm reduction to substance use. However, it is looking at harm reduction from the perspective of injection drug use, because each consideration here has to do with injectable drugs, for the pharmaceutical opioids, cocaine, heroin, and maybe methamphetamine, all those ones that if you look at the harm reduction strategies here that has been provided in that document, they are all geared towards these particular kind of drugs. There is none here that actually addresses harms due to cannabis use or alcohol use or tobacco use. So, but when we look at medically assisted therapy can be used to address all these issues, because that means using medication to treat people for harms or disorders due to substance use. And in that medication assisted treatment, you also have counseling and other behavioral treatments that can be given to someone who uses substance. Now, this also, the NDCMP protocol the document they have just given us also focuses on the issues of HIV and other STIs. But when we talk about substance-related harms, we go beyond this to include aside health. We talk about other issues that have to do with an individual's whole life, the individual's well-being, your social interaction and all that. And so when we talk about that, when we look at it from that point, we talk about these other strategies of harm reduction. Reducing access to, for example, reducing access to alcohol, reducing access to tobacco, reducing, creating restrictions around where and when you can smoke. And we know that some of these laws and policies are already in Nigeria, but the truth of the matter is that they are not really implemented and people are not really following them. Tobacco use is a big challenge, and we have this challenge is shown in different health issues, including tuberculosis. Now, harm reduction strategies here also looks at educational materials that can be used to help. The same document of the NDCMP looks at as well as the NDLEA also, they look at applying this some of these strategies, especially the ones around advocacy, to schools, to market women, to artisans and all that. But we rarely get these people working with actually individuals who are using substances. And this is where harm reduction is concerned, is actually meeting that target group, people who are using substances, and getting them to, begin to think of, reducing the way they use substances. Harm reduction has been adopted by many nations, though most of them are foreign countries, countries from the developed nations and Western world. But we are happy to also proclaim today that Nigeria, by its provision in the current NDCMP document, has also adopted this harm reduction approach, even though it is looking at it from the issue of reducing harm due to pharmaceutical opioids. Now, we want to see how can we move forward from where we are with this current 2021 to 2025 NDCMP document. That's the National Drug Control Master Plan. How do we move forward from here as substance use professionals? What can we do? First, we must look at our perspective. How do we see harm reduction? The document sees it as harm reduction should be applied only to pharmaceutical opioids, but that is not so. We can actually widen our horizon. What is our perception of harm reduction? Some people think that harm reduction is there to encourage substance use, but no, that is not what harm reduction is doing. Even though harm reduction does not really think that you can only offer help when this individual is ready to abstain. No, that is not what harm reduction is saying. Harm reduction is saying meet that individual wherever they are and begin to help. And by God's grace, that individual may get to the point of abstaining. Now, what is the prospects of practice? We have a lot of prospects in Nigeria. Like I said, we have men who have sex with men. We have so many risky population, high risk population. We have women's, the female sex workers. We have the young people who are living in the suburbs, especially the suburbs, the rural communities, where this harm reduction can be taken to. Again, harm reduction is important for prevention. And when we talk about harm reduction prevention, it's not just the primary prevention as we know it, because most times when we mention prevention, people think only about preventing substance use. But harm reduction can be used to prevent abusive substance use, prevent harmful substance use, prevent dependence, prevent overdose. Like currently, we have a lot of challenges, not just in Nigeria, across the world, with pharmaceutical opioid overdose. We prevent also premature death when we apply harm reduction strategies. harm reduction strategies can also be used to prevent relapse in substance use. So harm reduction is fully involved in prevention, and these are areas we can get involved in. Now, harm reduction, the faith-based organizations in Nigeria do well. They are quite involved in the issues of substance use in Nigeria. But this is one area I think they can do more. They can do more in harm reduction, because it actually aligns with what they preach, whether it's Christian or Muslim. They are preaching support, they are preaching help, they are preaching love, they are preaching care. And these are the issues, the foundations of harm reduction. So the faith-based organizations can actually adopt this and help more. What are the challenges that we could have, even with the current master plan we have now? Some of those challenges is lack of evidence-based solutions. And so we need funds, we need sponsorships for research in this harm reduction area. Let's find out what are the harm reduction procedures that can actually help us move on, help our society, our nation to tackle these problems, harms that are due to substance use. We must be able to identify the specific and cultural relevant harms. The ones, how are these things harming us? How are they harming our young people? And how can we help? Now, law enforcement must also begin to change their perspective of harm reduction, because harm reduction is not encouraging either trafficking or anything like that. So when we can come to a point of compromise, I think it will help. Now, also, we need professionals who will be involved in the issue of harm reduction. So on this, and once again, I would like to say I'm sorry for the time we have taken trying to get our technicalities working. But right now, I believe that any one of us who is able to adopt the harm reduction would begin to think of wanting to help. That's what harm reduction does. Once you adopt that belief, once you adopt that approach, it makes it easier for you to want to help, instead of stigmatizing or discriminating against substance users. It makes it easier for you to, be willing to lend a helping hand.
Thank you so much, Anne, for this brilliant presentation. Despite the network issues experienced, I want to believe that participants have benefited from your wealth of experience. I know we're expecting some questions. I think we already have one question that we'll quickly address. Anne, can you hear me? Okay, good. So we have a question that will draw your attention to address. I think the summary of what the speaker presented to us is that harm reduction is not promoting drug use. In Nigeria, for example, 1 in 5 persons who use a drug has substance use disorders. The truth about it is that if those who have substance use disorders, if their attentions are not paid to them, they will continue to be a burden to the general population. So that is why promoting treatment, which of course involves helping the person to stop. But I must also say that not everyone who is using drug that ordinarily has the determination or willingness to stop has actually been able to stop. So that simply means that at least there should be something in place to help such people, and we cannot ignore them. So that is part of harm reduction that we're talking about, not necessarily promoting drug use. And let me also quickly add that as much as we do in terms of prevention strategies and other interventions, including law enforcement, for one reason or the other, because there are risk factors associated with substance use, some people may still use substances. So how do we address their cases? So harm reduction, what we are saying in essence is that it should complement other aspects of interventions, even the law enforcement. Of course, law enforcement has a major role to play, and the treatment interventions, even prevention, which ordinarily should be a primary focus. But where all of these are in place, attention should of course be paid to those who possibly are finding it difficult to stop. So that is where harm reduction comes in. Thank you so much, Anne, for that brilliant presentation once again. So,
thank you, sir.
Okay. We have a question here, which of course is not is part of the issues regarding harm reduction, different perceptions, and so on. There are some schools of thought that believe that harm reduction is to promote, alternative approach to supporting those who are possibly producing or manufacturing some of these drugs and so on. So what is your view on this? Is it that, for example, let me just put it straight away, heroin, for example, as one of the opioids, that is acetaminophen, as one of the opioids, right? One of the interventions that seem to have worked for the treatment of heroin use disorders is medication-assisted treatment like methadone, morphine, buprenorphine, and so on. So do you believe that those promoting harm reduction is more like they don't want to stop the cultivation of the poppy plant? They are now looking forward to bringing in this medication-assisted treatment so that they can continue or remain in business, or you can also relate to other opioids. And beyond opioid, you might also want to take it to other substances. Is it that they want to retain the business? That is why they are promoting harm reduction?
Thank you, sir, for the question, and it's a very important question because it will help us to clarify the issue as it is, especially for us here in Nigeria. Harm reduction, from its original model as provided by Cheung 2000, wasn't focusing on dealers or people who produce any form of substance, or even those who offer treatment. No, the focus was on consumers and still is on consumers. The focus is to help individuals who are at the point where they cannot help themselves. Individuals who are at the point where, because of their substance use, they are endangered. Okay, they could die. Yeah, so we talk about premature death. So now, individuals who, it is true that in harm reduction encourages people who use substances who may have come out of it, or who may have come to the point of being involved in managed use, regulated use, to help in going out there and doing outreach and advocacy for help for others, because we've had situations where individuals who are no longer very functional became quite functional, and they were able to become productive again. We live a self-directed life, be able to function as members of the society, get a job, get a home, even though they used to be substance, at the bottom level of life because of substance use. So these individuals who have recovered or are in recovery, many a times join the harm reduction group to do advocacy, to help people to understand that people can get better. So it has never been the goal or the intention for the harm reduction is to support people who are trying to do business, people who are trying to sell their drugs or sell their products, looking for alternative ways to make sure that they are still selling their products. No. And when we look at medication-assisted therapy, Of course, for the opioids, for heroin, of course, we talk about things like methadone and all that. But how about alcohol? How about drugs like tobacco and cannabis? You understand? We don't have people, when we apply medications to them, they are not such that those medications should also be addictive. Because when we try to work with people who have heroin dependence and you're using methadone may become addictive to them, though it is less potent or less addictive as compared to heroin. But when we are dealing with these other substances, we don't really use medications that are that addictive. So it's not the goal of harm reduction actually to support people who are selling medications or drugs to continue to sell. No, that's not the goal of harm reduction. Thank you.
Okay, thank you so much for clarifying that. Like you said, of course, there are different approach, to harm reduction. One thing that is usually very common when people talk about harm reduction is the issue of medication-assisted treatment, needle and syringe exchange, and so on. Let me add that harm reduction actually goes beyond that. Like we said, it is one of the ways to help those who are using drugs to make sure that they don't constitute or injure themselves, in the course of drug use for one reason or the other. Take, for instance, there are some people early in the morning, the first thing they do is to drink alcohol. Especially for those who have alcohol use disorders. What one can do, even in terms of harm reduction, is alcohol. Why not eat first before taking alcohol if you have to take alcohol? That is also reducing the harm that would have been associated with having to consume alcohol even before eating. So these are little things that matters, that can be different ways through which persons who use drugs that are finding difficult to stop for one reason or the other can be assisted. Let me also add that, of course, there are different, even for alcohol use disorders, we have the disulfiram and the acamprosate and so on that have also been, evaluated or investigated to see how effective they are in helping people who are using or who have alcohol use disorders as part of managing their alcohol use. So all of these are evolving, even though, of course, some have gotten to advanced stage, but the non-even medical use, the non-medical approach to harm reduction is something that we can also beginning to encourage, because some of these medications really are not cheap. They are really very expensive. So let me quickly check if there is one or two questions. Okay, there are questions, because I will plead with ISSUP, Olivia in particular, to give us 2 more minutes to wrap up while we check if there is still anything to clarify. Okay, there seems to be none. So to wrap up, maybe 1 or 2 sentences that you have to make quickly, Dr. Ann. That reminds me.
Martin, sorry.
Ejikeme, are you there?
Yes, sir.
Yes, Olivia, we are wrapping up in 2 minutes. Ejikeme, are you still there?
I was going to say it's okay if you want to run longer due to the technical issues. Please, there's no rush. Feel free to continue your discussion.
Okay, thank you very much. At least in that case, participants, please bear with us and let's use these few minutes to wrap up. I will close exactly in 6 minutes time. By West African time, it will be 10 minutes after 4. Depending on where you are, just add 6 minutes to the time from now while we wrap up. So Ejikeme, anything from your side, any question or anything you want the speaker to clarify, or at least share your thoughts briefly as we wrap up?
I think there's a question. that we have not looked at. It says, are there roles institutions are meant to play in harm reduction? The question came from Yona Oji.
Thank you. When you say institutions, I assume you're talking about probably educational institutions, healthcare institutions. Yes, they have a role to play in harm reduction. Like I mentioned earlier, harm reduction looks at prevention. Let's look at the educational institutions for now. It looks at reduction. It looks at prevention of substance use, and it does that with educational materials where we are able to hand out particular materials that inform people of the drugs they use. Many a times, young people, like as the UNODC pointed out, people, the level of cannabis, for example, we have in the markets now, we have cannabis species that are much more potent than what we used to have, and then instead of use to decrease, use of cannabis is increasing. And you see that despite the potency, young people are more involved in taking cannabis. And then they also want to go for the most potent version of cannabis. Now, why is that so? Because they are ignorant of the impact of this potency. The more potent cannabis is, the more problematic it is. But young people do not know. So assuming we have an educational institution and we are able to share information that helps them to understand that you should know the drugs you use. Before friends, peers get you involved in substances, you should know them. So educational institutions have a role to play. Healthcare institutions have a role to play also in this advocacy as well as outreach, even taking the public health approach to it. They have roles to play. When we talk about the lawmakers, our different levels of leadership, the houses, the Senate, they also have roles to play in making sure that this harm reduction is taken and becomes part of our homes, part of our family, part of our discussion. Thank you.
Okay, thank you so much for that. I think what you have just said is that everyone has a role in addressing substance use issues generally, both prevention, treatment, and possibly harm reduction. The only thing I would like to add there is that harm reduction focus should be on those who have started using drugs and seeing how at least their use of drugs can how the harm of their use of drugs, can be minimized. Like you rightly said, polydrug use. What you see, presently or at the moment, especially among those who use drugs, is polydrug use and what I ordinarily refer to as ingenuity in drug use. Mixture of different kinds and so on. So if one is relating with such people, for example, the fact that one possibly is able to at least educate them on the harms associated with this mixture, of course, the better, and eventually maybe reduce from a combination of different substances to a particular drug, then later on eventually stop using these drugs. Of course, abstinence should be the overall goal, but where that is not achieved, at least those who are using should be assisted through the recovery process until when it gets to a stage that they can eventually stop. I think that is the summary of what we've learned today. So we just have 1 minute, and if you still have anything to say, please do that in 30 seconds while we close.
Yes, I would like to say that harm reduction is extended to social determinants of substance use. If we can work on reducing the social determinants of substance use, reduce them so that these individuals won't even get into substance use. It will go a lot to help. And this is where we have challenges in Nigeria. Availability of substances, accessibility of substances. If you can reduce these particular issues, reduce accessibility, reduce availability, then we'll have fewer people who are getting involved in substance use and the harms due to them. Thank you. And thank you to our participants, our audience. Thank you for your patience. Thank you for being here for us. Thank you.
Thank you so much, Anne. I love the way you summarized it. There are risk factors, and until we begin to address these risk factors so that people don't start using drugs in the first place, then we cannot stop talking about harm reduction, because that is why our focus of intervention should be on prevention, so that once these social determinant risk factors are addressed, it will reduce the number of people who will go into drugs. Then we may not talk much about harm reduction. So on this note, I will say thank you so much, Anne, for the wonderful presentation, and thank you, Ejikeme, for being able to join me to moderate this session today. To the participants, we say thank you for being with us and for sharing your thoughts in the course of this presentation. And maybe when next we're going to see, it may not be via webinar, it might just be face-to-face at ISSUP Global Conference for those who will be able to make it there. So once again, our appreciation to ISSUP Global for the wonderful support, particularly Olivia, we thank you, and other colleagues from ISSUP Global for this support. And to the participants, once again, thank you for being patient with us despite the network issues, and look forward to see you again in another session of ISSUP Nigeria webinar. Thank you, and bye for now.
Thank you so much, sir. Bye-bye.
Thank you. Thank you. Bye.